to
Can hear and see now, not in presenter mode yet.
Yes, we are working on it. Can Brayden have his phone back?
I think it's still going through Brayden.
Oh, okay, gotcha. And how do you do presenter? Perfect.
Oh, okay. Sounds good. In a second. A little bit hue. Good. Okay. Yeah, I think it's supposed to be pink. That's what I was thinking here too.
Yes. Amulyas Kadaba. Is that how you say it?
Yes.
Okay. All right. Sorry for the technical difficulties. Actually, I'm going to introduce you. I don't usually introduce you when we host you, but for those on Zoom, my name is Marissa Gray. I'm the Biomedical Engineering Program Director, and I would like to welcome you to Amulyas Kadaba's thesis defense. She came to us in fall. Let's see if we can. More slideshow options. Hide presenter view.
Oh, yes.
There we go. Okay. So Amulyas came to us in fall of 2023, and she is graduating in May. I almost said this month, but next month, with her master's in biomedical engineering, and she did some really great research with Brayden, right now, Jill. Okay, good. Brayden. Sorry, this introduction is going a little off the rails, but we will let Amulyas take it away.
Okay. Thank you so much, everyone, for coming to my master's thesis defense. I'm so sorry for all the technical difficulties, but today I'll be talking about quantifying mechanoreceptors in a porcine ACL. Give me 1 second. Let me just make sure that y'all can't see the zoom. Well, the zoom thing. Let me move that out of the way.
Yeah, you can hide that.
Okay. This one. Just gonna put it down here. There we go. Okay, sorry. I'm going to be talking about quantifying mechanoreceptors in a porcine ACL, a comparative analysis of histological staining methods. Ooh, nope, now it's not letting me move. Okay, there we go. So there are about 200,000 ACL injuries annually, and the ACL has 4 primary functions. It stabilizes the knee joint by holding the femur and tibia together. It guides the knee through its normal range of motion. It regulates the sensory motor system through mechanoreceptors embedded in the ligament. It allows for proprioception and dynamic joint stability through the ligament-induced neuromuscular reflex. To further explain, the proprioception is when the mechanoreceptors tell the position of the knee joint to the body, so it gives position and movement related information. So for example, if you move your knee right now, you'll be able to understand where it is in space without actually looking at it. Furthermore, when playing sports, the ligament is able to reflexively activate the muscles such that it is not injured. So, like I explained, the mechanoreceptors detect position, movement, or acceleration based on internal forces. There are 4 primary types of mechanoreceptors. We have the first 2, which are the Golgi tendon and the Ruffini corpuscles. They detect tension, but at different thresholds. We have the Pacinian corpuscles, which detect vibration and pressure. Lastly, we have the free nerve endings, which detect pain. Currently, there is no consensus on the precise quantity and identity in a healthy ACL, and there is a positive correlation between mechanoreceptor quantity and proprioception. So after an ACL is injured, the typical procedure done is ACL reconstruction. It is when the injured ACL is completely removed and replaced with a tendon graft. The mechanoreceptor quantity is usually diminished in healing ACL grafts, and because of this, the neuromuscular function is not fully restored, and this procedure is illustrated in the top figure. The new procedure that exists is the Bridge Enhanced ACL Repair, called BEAR, which is illustrated in the bottom image. It basically bridges the 2 ACL remnants together with a BEAR implant, and it does not require the removal of the injured ACL. The hypothesis is that it would have superior mechanoreceptor retention. Our long-term goal is to quantify the mechanoreceptor differences between healing ACLs that have been restored through Bayer, healing ACL grafts, and uninjured ACLs in a large animal model. So why would we choose a porcine ACL model? And the reason is that they have similar anatomical characteristics, such as having the same two ACL bundles, following the same pattern, and having similar femoral origins. They also have similar orientation and an hourglass-shaped morphology. They also have similar biomechanics, such as mirroring human ACL functionality, such as restricting anterior tibial translation. They also have a similar ultimate load to failure. The study has three specific aims: identification and quantification and optimization of the histological technique for detecting mechanoreceptors in the porcine ACL, quantification of the number and spatial distribution of mechanoreceptors present in the porcine ACL, and lastly, evaluation of the reproducibility of mechanoreceptor counts between two examiners. So we obtained the ACL from juvenile pigs. We removed the ligament with portions of the tibial and femoral insertions. We decalcified the ligament and sliced it in the sagittal plane with 7 micron thick slices and 100 micron intervals, resulting in a total of 64 slices. So the reason we chose 100 micron intervals is to ensure that we do not double count mechanoreceptors, as certain mechanoreceptors have a larger morphology. So our initial mechanoreceptor quantification criteria is that we used Freeman and Weich's classification criteria, which has been used by other primary literature. And we also used other literature to guide us for classification. We then looked at the stained neural structure's proximity to blood vessels. We also looked at the location within the tissue, such as whether it's in the insertion sites or within the ligament. And we also looked at the quality of the tissue. First, we conducted a literature review to compare the histological techniques. There is no optimized staining approach yet, and there are a total of 5 different staining approaches. 3 of them are immunohistochemical, and 2 of them are metallic salt staining. The first 3, S100, NFP, and P75, PGP 9.5, are IHC or immunohistochemical techniques. They're known to be more reliable and easier to perform compared to metallic salt staining, which are gold chloride and silver staining. And the reason for this is the metallic salts need to be impregnated into the tissue, which can really vary with the tissue thickness. And many literature have found that because of the variation in tissue thickness, they've had a hard time conducting this histological technique. So we selected the NFP and found it to be the most reliable because it stains all mechanoreceptor types, is specific enough, has great visual contrast, and has variability with, and does not have variability with tissue thickness. So we were able to successfully stain the ligament with NFP, and here are examples of the slices and neurostructures that we found. So slice 5 is when we found the first mechanoreceptor. Slice 32 is roughly in the center of the ligament, and slice 64 is on the other end of the ligament. And the top image is roughly where these slices would be located. So based on the literature review that I conducted, all 3 neural structures are most likely Ruffini corpuscles. I then quantified the mechanoreceptors and found a total of 316 mechanoreceptors across the ACL. I then plotted and determined how the mechanoreceptors are distributed across the ligament and found that they are fairly distributed throughout the ligament, but there is an increase in mechanoreceptors from the earlier to the later slices, so towards slice 64. I then also mapped the mechanoreceptors from slices 1 to 47 to determine the spatial distribution of the mechanoreceptors across the insertion ligament insertion area. And this was done onto slice 14 as it had a clear image. And I did not map mechanoreceptors after slice 48, specifically because the mechanoreceptors on the viable ligamentous material was over a small region, and I was not able to accurately determine if it was in the ligament or in the insertion sites. So based on this image, we can see that the mechanoreceptors are concentrated in the insertion areas and in the middle of the ligament. But we can also see that there's a difference between the insertion sites. There's a greater concentration at the femoral end compared to the tibial end. Lastly, we conducted the repeatability assessment and found that there was a 73% overlap between the two examiners. Although it is a fairly low overlap, we did find a consistent trend of the mechanoreceptors between both examiners to be distributed throughout the ligament and an increase of mechanoreceptors as we move from the early to the later slices. I then also mapped the mechanoreceptors of slice 46 between both examiners, and I chose slice 46 because both examiners found a fairly large amount of mechanoreceptors. Examiner 1 found about 16 mechanoreceptors, and examiner 2 found about 22. And though there is a small difference between them, we're able to see that there is a fair overlap in the spatial distribution between both examiners. So overall, we were able to select and optimize the NFP staining technique. A total of 316 mechanoreceptors were found, with a consistent trend increasing from early to the later slices. 155 mechanoreceptors were mapped across the ligament insertion area, with concentrations at the insertion sites and in the middle of the ligament. We did have a difference between the femoral end and the tibial end, and there could be two reasons for this. One of them is that because we were not able to map all 316 mechanoreceptors, it could have caused a difference and we were not able to see a proper trend. Or the other reason is maybe this is an actual trend that one end could have more than the other. Then we also had an overlap of 73% between examiners, but this could indicate that we need a more rigorous objective identification protocol. So we tried to postulate why we had a low count overlap and narrowed it down to 4 primary reasons. The first is that there is varied interpretation of the identification criteria. So among the primary literature, we found that many studies did not really specify the tissue orientation, the slice angle, as well as the interval between these slices, which are really important to understand the mechanoreceptor morphology. So because of this, we had a very vague and varied definition of the mechanoreceptor morphology. Next, we did not standardize the staining intensity and color threshold. We also had varied screening methods between the two examiners. So examiner 2 captured all stain regions without pre-screening, and examiner 1 pre-screened and applied stricter filters. So because of this, examiner 1 re-evaluated the slices that had greater overlap, and it increased the overlap to 88.6%, which could really highlight that because of the difference in screening methods, there was a difference in the number of mechanoreceptors counted. So even with this increase in overlap, there is still a consistent trend of increased number of mechanoreceptors from the early to the later slices. So we revised our quantification criteria to include a more precise morphological definition, a quantitative staining intensity threshold, same screening methods between examiners, and lastly, assessing structures in the same spatial coordinates across multiple slices to ensure it's not a single sagittally sectioned nerve fiber. So when compared to previous literature, in a human model, studies found a median of 18 mechanoreceptors per ACL remnant. And they did find a higher mechanoreceptor density at the ligament attachment sites, but did not find a distribution difference between the attachment sites. So overall, they did find a substantially lower amount of mechanoreceptors, but the reason for this could be because they're looking at an ACL remnant. So it's not an accurate for how a healthy human ACL could be. It could be a much lower number in an ACL remnant. And it did agree with our study that there was a higher mechanoreceptor density at the attachment sites. When compared to other animal models, they found a median of 17 mechanoreceptors in a rat model and 27 mechanoreceptors in a sheep model. Similarly, a substantially lower amount of mechanoreceptors, but the reason for this could be that maybe a porcine model could be more accurate to what a healthy human ACL could look like because they have more similar anatomical and biomechanical characteristics. And this model also had an increased receptor density at the insertion sites, which does agree with our study. We did face quite a few limitations, so we had to conduct multiple iterations to optimize the staining protocol, and it was fairly time-consuming. We did have a small sample size of just one ligament. We did have artifact staining. We had a reduction in viable ligamentous material available for the histological analysis as the slices progressed through the ligament. And lastly, we only used one staining technique. So for our conclusion, we had foundational and anatomical insights into the total count and spatial distribution of mechanoreceptors in a porcine ACL. We optimize the staining approach for mechanoreceptor detection, and we offer baseline for future comparisons with ACL grafts and bare repaired tissues. For our next steps, we plan on adding a complementary staining method, such as S100, which is a common co-staining method used in other primary literature to minimize potential misidentification. We also plan on assessing 5 new porcine ACL to evaluate the inter-examiner reliability with a larger sample size with refined identification criteria. And lastly, we're in the process of developing a protocol to assess mechanoreceptor function following bare and ACL reconstruction with an impact loading system. So on the left, it's switched, but on the top image with the 3 co-staining, we have in red the NFP stained neurostructures, and in B, we have green S100 stained neurostructures, and C labeled with 1, 2, and 3 are neurostructures stained with both S100 and NFP, which could show that maybe these neurostructures are mechanoreceptors as they're stained with both NFP and S100. And on the other end is our progress for the impact loading system. So on one hand, we'll have a hook that'll hook onto the porcine ACL, and on the other end of the pulley system, we'll have a predetermined weight dropped at a predetermined height, which will then trigger the ACL hamstring reflex arc, which can then assess the mechanoreceptor functionality. And the latency of this reflex arc will then be measured to compare with the bare ACLs as well as the reconstructed ACLs. Thank you. I'd like to thank my PI, Dr. Fleming, as well as my committee members who have supported me through this project. I'd also like to thank everyone in the Brown Lab. They've been really helpful, and I'd like to thank my friends and family.
Thank you. It's open for questions. Anybody have any? So we can see it live, right?
I can see online. I can
Okay.
moderate online. No questions online.
Sorry, I think.
Thanks. I have a question in regards to the slice membrane.
Mhm.
Where is that falling along anatomically? Is it at one end like tibial insertion and the other end is femoral insertion?
Great question. So from 1 to 64, so it's basically the slice, it's sliced like this. So we would have one end being the femoral end, the other being the tibial end. So we're not entirely sure which one is the medial or the lateral side. We have to confirm with Peter, but we kind of have an idea. Maybe one could be the medial end and 64 could be the, lateral side, not end. Medial side and one could be the lateral side.
Thank you.
No problem.
This is a little bit hypothetical, but
Mhm.
if I want to study when you do the ACL graft repair versus the, I guess, baseline case, somebody wants to study the evolution of mechanosensors over time. You've done a pretty nice staining method, but I think it's a post-processing, right? You have to take it out.
Yeah, exactly.
Is there a way in future to look the time evolution of mechanosensor development as ACL is repaired?
I don't know, that's a very great question, but I would assume that because we need to remove the ligaments to stain them, we would not be able to really look over time. Because we can't do it in someone that's currently has the ACL attached to them. Great question.
Is there a way to do it in a control environment? There are a bunch of ligaments and kind of going through the same thing, and then you cut each of them separate times? Do relative study. That's in vitro study, not in vivo.
Maybe.
Again, maybe that's the genetics system.
Yeah,
That would be a cross-section study.
I see.
They gave us at a different time.
Right, I see.
A question about your, you found a lot of mechanoreceptors, probably more than anybody else has ever seen.
Yeah.
But do you think size matters here? Because if you find, what are your thoughts around that? If a rat ACL is much smaller than, I think, a rabbit, than a pig, than a human. How do you interpret that? How do you, is that, does size matter in your interpretation of number of mechanoreceptors?
So maybe I would think, at least what they say is that a porcine ACL is similar to a human ACL, so perhaps that might be the reason why we find more. Because we can't really compare to a healthy human ACL. So when compared to a rat model, which is not as similar, or a sheep model, which might not be as well, so maybe size could be one of the things.
Do you know, can you think of a way to normalize that, or a way to kind of how you could factor in size versus count?
Maybe over the area that we find mechanoreceptors over a certain area.
Do you think that could be done in your study and related to kind of maybe a way to normalize to what's been previously reported?
Maybe I can do that, especially with the human ACL remnants, to discern if it's maybe mechanoreceptors over something really small.
I think that could be helpful to help kind of maybe better align your reported results with like a rat.
Right.
As I would think you would find if you just look at raw numbers.
Right.
A rat would be, I don't know, what, 5% size? Less than 5%?
Yeah, really tiny.
Than a pig ACL. So I think that could like explain some of the dramatic differences between your species comparison.
Makes sense.
Building on that, do you think these methods are detecting the nerves themselves, which are going to be much smaller than a receptor? Is it possible that the overcount has to do with picking up nerves as well?
Yeah, it could
what
be.
can be done to eliminate that problem?
So at least because we don't have a really defined definition of what the mechanoreceptor morphology is, so we're looking at, so it might seem a little bit crazy, but some of them are what they define in morphology is could be between 100 and 600 micrometers. So because it's such a wide range, that could definitely be a possibility. So maybe to combat this, we need to do more of a literature review, but a lot of studies don't really do histological staining that much because it's quite difficult to conduct.
Are there other, this also relates to a question I was going to ask earlier, are there other tissues that have mechanoreceptors that have been better documented?
Maybe. At least I was looking at skin mechanoreceptors as well, but I don't think some of them, maybe the Golgi tendon organ or a few of them are not in skin, so it's a bit hard to determine the size for that.
And do you think that, are there other tissues within the knee that probably have proprioceptors that contribute to proprioception? Sounded like it was just the ACL contributing. Are there,
Yes, there definitely is.
And has anybody done any work in tendon?
I'm not 100% sure, but I think they have, at least after the ACL is replaced with a tendon graft. I think they also do mechanoreceptor studies to see whether there's enough mechanoreceptors or if it has diminished or if it's equal to an ACL. So
I think if that's your ultimate goal to compare, as you said, the long-term results, it would be another good thing to think about would be like, does their staining work in tendon? How many are in tendon?
I see. Okay.
So I don't know that there's literature out there too.
Yeah.
So what's your thoughts on people have tried to do these remnant sparing surgeries? Like what do we do with this information if we know the distribution of mechanoreceptors? How does that relate to some of the surgeries being done?
So just to reiterate the question, you're asking about how the mechanoreceptor quantities relate to the remnants?
Yeah, want some of that, like if you now you know where the mechanoreceptor locations are. You said I think they're mostly at
the insertion sites.
Yeah. And one of the surgeries that have been done in the past is these remnant sparing surgeries. And I think they focus on one end versus the other. Based on your data, should we be focusing on the femoral end more than the tibial end?
I probably wouldn't give a conclusive answer because we weren't able to map all the mechanoreceptors, but we don't know if it's a new trend with it being concentrated on the femoral versus the tibial. So I don't think I would give a conclusive answer to that.
I know you talked about your thesis focusing on the tibial end.
Yeah.
So I just want you to expand on that based using the data.
So
maybe not focus on the tibial end, maybe.
Yeah, maybe, or rather with another, with more ACLs, because we only did in one ACL, so I don't want to be like, okay, this definitely must be it. So if we do it in 5 other and we see a consistent trend, then maybe, yes.
To help answer that question, where do ACL tears primarily occur?
Ooh, it's a great question. I think maybe towards the center or at the insertion sites. Not 100% sure.
It's closer to the femoral insertions.
I see.
And you had more
At the femoral end.
femoral.
Yes.
So you'd be cutting that out to do the reconstruction, but you're also boring out the center of the remnant, so it's hard to believe it's an effective method to preserve it.
I was trying to get at some of that. You could feel the direction I was trying to achieve. Because I think that could be interesting, as you said, as we get more TBLs, that, this tibial sparing remnant probably doesn't do as much if all the chemoreceptors are up where it tears.
Right.
And it's not preserved. So that could be quite interesting in the future. Any other questions? I have only one more. One more, and then we'll let you off the hook.
That's good.
This data came from juvenile. I think it's even a younger age. Yeah, it was like they were Yorkshires, right?
Right.
So they're like 3 months old. Yeah. So quite young. Are there, in the literature, what you know about mechanoreceptors, in general, it could be any tissue, do we know whether the counts change with age?
That's a good question. I'm not 100% sure. Don't think I know. Because a lot of them do studies, I would say, in rats are like in the middle of their life, so I'm not 100% sure.
Again, it might be something interesting to see, because I think there's some of the pig developmental studies show, or even not just pig, but others that cellularity changes with age, it decreases. So I don't know what that does to the rest. Like, what other things are changing as the ligament matures.
I do want to point out that because not many studies do histological analyses, I was not able to find a lot that did in a porcine model, which is fairly interesting. Not sure why. Oh, expensive.
Been
Okay.
popular, I think, for orthopedics in the last
I see.
15 years.
Oh, okay.
So I think that's why. So I think casting abroad net will also be interesting. Okay.
That's it.
Wrap it up.
Thank you.
Thank you. I do have a signature page with me, which I'll pass around if that's all right.
And help the atlas come.
It is working through it. I have images through the literature review. I wasn't 100% sure if that's what you meant, of having pictures from different literature review and then the morphology next to
No,
it.
I think what you need to do is two elements, particular, but more towards what you developed,
Okay.
right? Because you talked about, we scored them using criteria. What were the criteria specifically? Was it this size? Was it that size? Was the stain dark? Was the stain light? Was it on a scale of 0 to 10?
I see.
The staining was 2, I didn't count it. The staining was 8, I counted it.
I see.
And you have examples from your data, not the literature, your
I see.
data, of what corresponded to a mechanoreceptor, yes, I'm counting that, or no, I'm not. Because really the next steps and the purpose of this is that you can hand it off to the next person, which happens to be Anika.
Right.
But it's really creating that atlas, because you said there's nothing in the literature, right? And so you can't find it in the literature.
Yeah.
Make it.
Right. That
And
makes sense.
that's what you need to do
Okay.
for your thesis, because I think that is a really central piece
Right.
of your work.
That makes sense.
And so that can go in as an appendix.
Okay.
And for the thesis to be complete, I'll sign it today, but for the thesis to be complete with that, it needs to be not the literature.
Sounds good.
Like we have stretch, we prefer. I think, yeah, there's definitely some in there. Burn, there's ouch. Is it blue?
I think it's black. That's all right.
No, it's blue. Gotta be blue. Because black is the photograph.
ಹಂಗೆ ನಾಳೆ ಪೇರ ನಾಳೆ ಮೂನ್ ಪೇರ
Yeah, so get like it's one of them like about skill because they're using our receptors. I think it was pretty strong.
ಇನ್ನೂ ಸೆಂಪಣ್ಣ ಇಲ್ಲಿಂದ
That's why I practice. I just know that. Don't worry.
Because but it's really we're in terms of like diabetes.
What's today?
Yes, we're 23 4.
That's why I have to write it out.
Yeah.
I get it right. I have a question. What is classified in the pre-surgery versus a pivotal procedure? Did you guys say?
Oh, yeah.
The pre-screening was just like, oh, I scanned it, and I'm like, nothing was yellow, so I didn't even look at this. Like,
Nothing was red, but yeah.
okay.
Very nice job. Presentation you manage after the technical difficulty. You were very calm or very
You got out of the big mess.
That is.
after all that you had a lot of questions, but you could.
I had the same question about Gia and Tom.
Yeah.
Is that medial or is that lateral? And I was trying to guess which side it would be.
I think it's medial to lateral.
Yeah.
But
Yeah. Based on the kind of length of
I
the.
said until we get confirmation, it was better to just
Translations.
Yeah. I'm curious about the current as well.
You just need one copy back. You just need one.
Maybe just the
The lateral and the medial. I bet you it's two bundles. I bet you this is the medial bundle and that's the lateral.
Oh, I think
It's not officially right now.
It's good to see you. It's also nice to meet you.
Value of the list.
You know.
Right, not normalized area.
No,
Yeah, just like remember it.
Because Zoom became
Because like slice one could be a little
Right, it's like, oh, yeah, because
Okay.
But it's not the same.
it's not, so I,
But the other thing too, I was saying like, it looks like it's two bundles.
Stuff sections.
This could be your medial bundle or your.
Yeah, when you're watching Break on the Instron, there's like one sliver left. Like one of it has to be the other half is like.
Hanging on, hanging on. But that's probably, I mean, either short or longer. Longer. It says probably the intermedial bundle, but it's longer. It's holding, it's still there. Intralateral probably carries more load. And so that's just, right, and if it's Jerry first, then that would. If that.
This year has been challenging for me.
Everything's fine. I love
He's already had
Over gap, it all over gap.
$5 to that.
So, just stay calm. through it.
Hopefully we get through
It's
it.
technical stuff.
Yeah. So does nobody ever even get to on this?
I think it was,
Jill, I'll say hello. I'll see you next time.
I'll see you Friday.
Friday, yeah. Thank you for being in the committee, and this was great. Thank you.
Perfect, great. We'll see you later. Have a good day.
Thanks, congratulations again.
Thank you.
Bye. Good to see you.
Good to see you too. What was I gonna say? Yeah, I think not having earphones also was challenging. 100%. But we sorted it. I think I hope they're not present.
It might be.
I
I made it back. Closed my laptop at the end of the meeting.
no problem.